Health on the Edge is an innovative new television series that presents the viewer breakthroughs in medical technology and the latest new therapies and treatments. Now more than ever, keeping up with information is a key in our everyday life. This knowledge gives us the confidence and control to deal with each decision on a daily basis. Unfortunately, the diagnosis of an illness often comes unexpectedly, leaving us feeling very vulnerable and confused. Studies have shown that when patients in such situations are asked what they discussed with their doctors, the retention rate of information is less than 5%. It is important for us to realize that we cannot become a passive participant in our healthcare decisions. Medical treatment is a proactive partnership between the patient and the physician. Health on the Edge is a working tool in that partnership. The program will provide the viewer with information on what is currently proving successful and will look ahead to future advancements in the medical field. Health on the Edge takes an in-depth look at stories that will touch your soul and will give you the information to work with your physician to make important decisions that will affect you or someone you love when faced with a medical situation. Stories like breast cancer awareness, who is most vulnerable, what causes it, and what are the steps to avoid this disease. Let's take a look.
Who's at risk for breast cancer? You are if you're a woman. That's the single biggest risk factor. The older you get, the higher the risk. And if there's breast cancer in the family, you've got a strike against you. But only a fraction of women can trace their own cancers to family history or age. Doctors can't explain why 2/3 of their breast cancer patients have it.
We don't have a clue what causes breast cancer.
But they're investigating some possibilities.
When you have a child, you lower your risk of breast cancer.
But that may not be true for women who delay motherhood.
A lot of alcohol can increase breast cancer risk.
We've done a lot of work, a lot of research on the relationship between stress and cancer.
In general, white, educated, affluent women are most susceptible. Environment and genetics are factors, and scientists are suspicious of the effects of everything from pesticides to the birth control pill. But the truth is, no one knows what causes breast cancer in most women. Any woman can get it, and 5 women die every hour because of it.
Breast cancer is raging, and we don't understand why, where, or how come.
Diana Matherly's life remains a work in progress because medical science has come so far. She's beaten breast cancer twice. Her paintings reveal the loss she felt, her fear, the friends who helped, coming to terms.
I feel whole as a woman. I'm very much of a woman without breast. I believe the woman is within.
Through her art, including a photo exhibit of her cancer experience, she wants to reach out.
I want to have a strong voice for other women in this world. Hey, there's a reality to breast cancer. Please check out your bodies. Take charge. Your body belongs to you.
Why do women get breast cancer? How can you be sure you won't? No one has all the answers yet, but we do know you can't hide. Eating and living healthy, paying attention to your medical care, supporting the efforts for better awareness, especially your own, may help end the question someday. In the meantime, we've got to keep asking them.
Now I just want to live every minute. Living is the thrill of life.
Health on the Edge is aware that most people out of fear tend to allow themselves or their family members to diagnose their ailments rather than seeking professional help. It is believed that half of all people afflicted with conditions such as rheumatoid arthritis, which currently affects more than 2 million people in America, do not seek medical advice.
Most patients diagnosed with rheumatoid arthritis, as long as they're diagnosed in time, will not have any of the damage and basically live normal lives, just taking medication every day.
Several therapeutic advances based on cellular and molecular biology are now being worked on by companies like Amgen. As the patient, it is up to you to take the first initial step. However, certain diseases, such as osteoporosis, are difficult to detect until an incident has occurred, which is normally in the later stages of the disease. Metro Biosystems is currently working on biochemical markers and immune systems to detect abnormal bone loss, thereby preventing osteoporosis from developing. So whether you are a parent of a sick child, a caregiver to the elderly, or someone who is thinking of receiving the latest body-enhancing treatment, Health on the Edge and its professional staff will inform you about what's new, what's safe, what's the alternative, and what works. Let Health on the Edge present your company's health products and services to a nationwide television audience and help improve their health awareness and knowledge and your sales.